Okay, thanks a lot for the invitation. It's a pleasure indeed for me to be here, and particularly in this session on public health, because it's so vital, and COVID-19 has demonstrated really the importance of public health for a resilient health system. So my name is indeed Costongs, and I'm director of Eurohealthnet. I will talk about three things. One is how COVID-19 led to increasing health inequalities. I talk about the need to cooperate along the 10 essential public health operations. And I will share with you some ideas for a European health union. Maybe first a few words about who we are. So Eurohealthnet is a European partnership of national public health institutes, regional health authorities, and several research centers. We bring together 65 member organizations across the European Union. And in Germany, we work very closely with the BZGA, the Bundeszentrale für gesundheitliche Aufklärung. And in fact, they are a member of our executive board. But we would also be delighted to work with the Robert Koch Institute indeed. Our main objective is to reduce health inequalities in Europe. We have an office based in Brussels. We are very much linking with European institutions, Commission, Parliament, but also with WHO and with policymakers in member states. And our main objective is to facilitate cooperation among the organizations. And we at Eurohealthnet are very concerned that COVID-19 is increasing health inequalities, because we have seen that the pandemic has the heaviest impact on the lives of the people that are living in deprivation or are at risk of poverty. This works through several pathways. They risk to have a higher exposure to the virus because they live in more cramped houses or work in crowded places. It may be also more difficult for them to do some teleworking because they are working in the front line. It's also more difficult maybe to go in quarantine because of the potential loss of income. And in addition to having this higher exposure, they also have an increased risk of getting a more severe form of COVID-19, because they often have more pre-existing medical conditions like heart diseases, like diabetes, and that leads to a higher premature risk from dying of COVID-19. So we shouldn't really underestimate also the health impacts of the mitigation measures. The people losing their jobs, becoming unemployed, less income. This has clearly effects on mental health and well-being. And we are already seeing increasing demand for food banks. So the prevalence and the severity of COVID-19 pandemic is magnified because of these pre-existing chronic diseases and inequalities. So in fact, we can also look at COVID-19 not only as a pandemic, but maybe also as a syndemic, as was put forward by Professor Claire Bambra and by Richard Horton in The Lancet, and so on, because the COVID-19 disease pattern is being interfered with the other health problems, the chronic health problems, non-communicable diseases, and the determinants of health. Because in addition to COVID-19, we see a huge burden of disease of the non-communicable diseases. It's in fact that about 70% of the disease burden are due to these chronic diseases. While we know they are to a large part also preventable, but 40% of cancers can be prevented. So the public health approach towards COVID-19 needs to be much broader, and we can do better here. And I think that coordination at the European Union is lagging behind. Public health is a very broad discipline, so this means that we do not only address the biomedical approaches, but also the psychosocial factors and work together. These are the 10 essential public health operations where we should work together. This is a model used by WHO several years ago. And you see that the operations center around the 3 main areas of public health service delivery. It's on health promotion, protection, and disease prevention. And these are informed by robust public health intelligence on the left side, like surveillance and so on, but also by enablers like governance, workforce, and communication. And all of our members, like the national and regional health institutes, have been working really hard in the past months to make extra hours, to work on surveillance, but also to understand the behavioral factors towards COVID prevention and towards risk factors of NCDs. They have been evaluating the effectiveness of these guidelines, communication guidelines, what works best, the AHA rule that I heard about that you're using here, and how do we make sure we do not lose the trust of the population. Some of the national institutes have set up specific behavioral units, like the Dutch National Institute of Public Health, RVM. They have set up a large behavioral insight units so that they can give scientific advice to the government on how the population is looking and interpreting the guidelines that are being given, but also how the population is doing physically, mentally, and socially in these times of Corona. Because mental health is key. Mental health and well-being has been profoundly impacted on due to COVID, as well as the mitigation and response measures. For example, Santé Publique France has, and other institutes also, have been implementing surveys on mental health, on the impact of COVID-19, on anxiety, on stress, on lifestyle factors like sleep, diet, on social media consumption, on caring responsibilities, and secondary consequences like unemployment on mental health. So there's a lot that we can work on in all of these 10 public health operations, and there is a lot of improvement. But I would say that there is now a real window of opportunity to strengthen public health at the European level, because it was even addressed by President von der Leyen. President von der Leyen, but that's the next slide. I just wanted to say here that there is a lot of opportunity for cooperation. I almost forgot to pitch Eurohealthnet, but it's not only Eurohealthnet, there are also other organizations at the European level. There's a lot that we can do. What we are doing is the counter-exchange visits. We organize many webinars to learn from each other. We have magazines, newsletters, we liaise with people, and so on. So a lot of exchange and working together at the European level. So there is this opportunity that have come up now by von der Leyen, the President of the European Commission. In her State of the Union address, she said, like, for me, it's crystal clear, we need to build a stronger European Health Union, and to start making this a reality, we must now draw the first lessons from the health crisis, and we need to make our new EU for Health program future-proof. So a European Health Union, that is what she wants, and there's a real opportunity for us to also, fill in this European Health Union. What does it mean? How do we see it? What features of public health do we think is important at the European level, and where can we work better together? Clearly, the European Health Union is very much in line with the existing treaty. Article 3, for example, of the treaty states that the aim of the union is to promote well-being of its people. But Article 168 is another important one that provides commitment to address health in many other policy areas. And already within the existing treaty, we can see and we can strengthen the health mandates and get with more powers in a way at the European level to shape this European Health Union. As part of the European Health Union, the Commission also wants to set up a new agency, the EU BARDA, That's a European Biomedical Advanced Research and Development Authority. Their proposal for this new agency will work alongside the EMA, the European Medical Agency, and the ECDC, together with an expansion of the competencies of these two agencies. And the idea is that the capacity will be increased for more cross-border cooperation and to improve coordination among member states. But I must say that I'm a little bit concerned by this narrow approach. It's again a big boost for a biomedical focus, but I also would want to see a boost for a psychosocial approach, because otherwise it leads to a limited extension of power, and we also want to address these root causes of ill health and disease. And for the European Health Union, I also must say I don't want this to be a top-down process, but very much a bottom-up process. We need to work with all of the member states, because there are many member states. There are lots of inequities or inequalities in Europe in terms of capacity of public health and to get engaged across the different states. We do not want to destabilize the union even more, so we have to bring everyone along, but also the subnational level, the regional level, and the local level, as we've seen in the presentations today, that how important the local level is. And I'm also very pleased to see that Germany is investing 4 billion euros in strengthening public health capacity at the local level. So ideally, we'll bring everyone along in the European Health Union. Then the European Health Union is not only DG Santé of the Commission or the Health Work Programme, but there are many other processes in Europe that are important for us public health people to be, at least to be aware of, but ideally also to sit at the decision-making tables. One of the most important ones is the European semester. The European semester is a tool for economic reforms in countries, but increasingly is including also advice and guidance on social reforms and health reforms. And the European semester is very much linked, or going to be even further linked, to big funding programs from the European Commission. So it's really important that that we as public health actors are there. The Commission is going to link the semester even further to the big EU Next Generation program. It's going to link it to the Recovery and Resilience Facility, which is about 672 billion euros of loans and grants. And member states are being asked to submit their plans before the end of April next year on how they want to spend these monies to help further reform their systems. There are a few flagship areas, for example, e-health, digitization and health, but also on transport where we can link health, or skills of people. And clearly there's the new MFF, which is a new multi-financial framework that is being in the make, which includes a big EU for Health program and other opportunities to fund for health. Then there's the European Green Deal. It's an overarching economic and green strategy. We need to take this up and be there and see how we can work towards a real economy of well-being strategy, which was launched by a previous Finnish presidency. The economy of well-being strategy is a message that investing in health is investing in the economy, and includes all of the lessons that we've learned with COVID-19. Then for the European Health Union, we would want to see a rights-based approach. And already there is the European Pillar of Social Rights, which is a pillar that is proclaimed by all the heads of states about 2 or 3 years ago. And it includes one principle, which is the right to health care. And we should use this much more and apply these rights. And just to give a last example, but there are many more examples of tools and processes at the EU level, but I like the EU Child Guarantee, which is a program or a recommendation is in the make for this, which is really important. Very few people in health is aware about this, while a quarter of all children in the EU are at risk of poverty, of social exclusion, and we know how detrimental that is for health and well-being. So this child guarantee helps to ensure that every child in Europe has access to free healthcare, to free early childhood education and care, to decent housing, and to adequate nutrition. So I think, again, this is an important instrument, and we as public health authorities, we have been failing to be really engaged and to make sure that health and public health is a strong, leading role in these processes. And partly that's because the public health workforce is in a way too small to lead on this process. If you look at Eurohealthnet, we have an office of 12 people in Brussels, and we are scanning all of these opportunities, and we're trying to engage as much as we can on behalf of the public health community, but obviously we can do much more. So in summary, we have to make sure that COVID-19 is not increasing health inequalities, and we have to act against this collateral damage caused by COVID-19 on mental health, on well-being, and on inequalities. We need a stronger cooperation across all public health services and all European countries and institutions, and strengthening these essential public health operations for more resilient health systems. And there are huge opportunities at the moment to achieve a European Health Union, but we need to take them and we need to be there. So there is Eurohealthnet at the European level, but there are also other organizations and European networks like ASHFR, which are the public health schools, or YAMFI, and of course there's WHO, as you've seen Hans Kluge in the plenary, and his new European program of work, and there are clearly great opportunities also with the reinforced link between WHO and the Commission. So how we are preparing ourselves now, and how we are strengthening and reforming our health systems and strengthening public health functions, but also like social protection and other public services, is fundamental if we want to be future-proof and not only tackle COVID-19, but other crises that are coming, that we are facing, like climate change, like continuing chronic diseases. So that's really fundamental. And in terms of our next steps for next year, there is a conference on the future of Europe by the Commission and Parliament, where the European Health Union is on the agenda. And next year also there is a global health summit, which is going to be linked to G20 in Italy. And I would be really keen to work further with you. And if any one of you would want to support or be part of Eurohealthnet or join our partnership, I would be happy to further liaise with you. Okay, thanks a lot for this opportunity and for your attention, and I look forward to the discussion. Thank you.